Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. Good day, everyone, and welcome to the first webinar in the World Patient Safety Day webinar series on medication safety. My name is Abir Mahanna. I am a pharmacist and a senior patient safety specialist at Saudi Patient Safety Center, and I will serve today as your webinar moderator. Our webinar today, the implication of the COVID-19 pandemic for safe medication handling. And as you know, during the COVID pandemic, many issues have been learned across the world related to medication safety compromises made. For example, the usual medication reconciliation was often skipped or inadequately performed. Patient counseling and education was also compromised. The drug shortage issues and using unapproved medication. These and other medication safety issues and the lesson learned from them will be detailed during this 1-hour webinar. We are delighted to have with us today Dr. Saleh Al-Anazi. Dr. Saleh is a manager for quality pharmaceutical care services in King Abdulaziz Medical City in Riyadh. He is a faculty member at the College of Pharmacy, King Saud bin Abdulaziz University for Health Sciences, adjunct assistant professor at Al Marifa University and Prince Sultan bin Abdulaziz University. He is a medication management surveyor at Saudi Central Board for Accreditation of Healthcare Institutions, Sibahi, with PhD degree in pharmaceutical science from King Saud University and master degree in total quality management from the Arab Academy for Science, Technology, and Maritime Transport, Alexandria, Egypt. He is a CPHQ, Lean Six Sigma, Green Belt, and Patient Safety Officer certified. He is also a member in the Medication Safety Program in National Guard Hospital. Before we start, I invite you all to ask questions using the Q&A icon at the bottom of your Zoom screen. And with that, I would like to hand over to Dr. Saleh. Dr. Saleh, the mic is yours.
Assalamu alaikum. Bismillah wa salatu wa salam ala Rasulillah, Sayyidina Muhammadin wa ala alihi wa sahbihi ajma'in. First of all, I would like to thank the Saudi Patient Safety Center to give me this opportunity to be with you today. Also, special thanks for our moderator, Dr. Abir Mahanna, and coordination, Dr. Nov and Ms. Hiba, and all audience today. My talk today, inshallah, about implication of the COVID-19 pandemic for medication safe handling, and I hope at the end of my presentation, I have provided you with the benefit information. Objective and outline today for my presentation. I will start with the define COVID-19 pandemic. Then I will explain the basic awareness and orientation on medication safety, safe handling, demonstrate some example for strategic and medication safe handling during COVID-19. Also, we'll present some practice with the participant on how to use leadership skills for better implementation of quality. Finally, I will close with the apply methodology to gain more skills on management. COVID-19. I'm sure all of you know about COVID-19. COVID-19 is severe respiratory acute infection with the spike protein direct bind with host cell surface for the AC2 receptor, facilitating virus entry and replication. It's mainly affected the respiratory tract and illness various severity from asymptomatic or mild to severe or critical disease. The lung are the most vulnerable organ due to its high susceptibility of AC2 receptor and cells, which serve as a main entry for this virus. Implication of COVID-19 on community. What the symptom for the COVID-19 or coronavirus? First is high fever, cough, sore throat, and headache. And how to transfer COVID-19 air contact objective. How we can prevent by wash your hands, wear a face mask, avoid contact, and cover your mouth. I will talk now about prevalence of COVID-19 pandemic in the worldwide. Globally, as of 9 August 2022, there have been almost 583 million confirmed cases of COVID-19, including around 6.5 million deaths reported to WHO. And 1 August 2022, a total of 12 billion vaccine doses have been administered over the world. Huge number. We'll talk now about prevalence of COVID-19 in Saudi Arabia, in our country. As of 9 August 2022, there have been almost 800,000 confirmed cases of COVID-19 with only, I have to say, only 9,000 deaths reported to WHO. As of 19 June 2022, total around 66 million vaccine doses have been administered. Saudi Arabia and COVID. Saudi Arabia has as well occupied one of the most advanced health systems in the world. Also, immediate action were taken promptly, including setting up a whole committee to implement the action needed against COVID-19. Moreover, alhamdulillah, the mortality rate is very low in Saudi Arabia compared to the other country. Only 9,000 case death in Saudi Arabia, due to best health care facilities available at all levels in the kingdom. What the consequence of the pandemic? First, temporary closure for air traffic. المطارات تقفلت كلها. Business establishment were affected. Temporary closure of government facilities. أغلب الناس صارت أو الوزارات closed and many of them work remotely. 100 educational institutions. People were not allowed to visit the two whole mosque, special for Muslim people. Thus, the kingdom has stopped exporting medical device equipment to ensure their availability during the pandemic, because maybe Saudi Arabia healthcare need these devices. Here, before I start the implication in the during the COVID, this is a question for you. Please vote about it regarding to the telepharmacy. Did just say yes or no? Did you implement the telepharmacy or virtually or any method from remote service in your organization? Again, did you implement the telepharmacy, virtual clinic, or any method from remote service in your organization? We'll talk now about pharmacy people or pharmacists, including or inclusion of pharmacists in the pandemic. Pharmacists are well aware and trained to deal with the pandemic. They have the capability, one second please. They have the capability to serve numerous positions during the latest pandemic. Also, pharmacists are most accessible healthcare worker, and thus they understand the misfortune of any outbreak like COVID pandemic, especially the outpatient pharmacist or inpatient pharmacist. Pharmacists in Saudi Arabia during the COVID-19 pandemic. The big job for them, or the first big job for them, it was track and address any drug shortages. As you know, a lot of drug shortage during the pandemic or after 1 or 2 months from the pandemic. Second one, made a remote pharmacy system to avoid human contact. All refill by the phone and delivery by car. No patient came to hospital. And many of services it was by the remote access. Present therapeutic-driven pharmaceutical treatment, inform the public on infection control and disease detection. Also, pharmacists help the other healthcare provider to inform the public about the infection and about COVID-19 sign and symptom. Informing patient about the pandemic and for COVID. Encouraging the avoidance of disease by recommendation and other advice to the all patient and society. Referring suspicious cases to suitable healthcare facilities in timely manner. When the patient is suitable to a suspicious case, send them to the suitable healthcare facilities to treatment there. Pharmacists in Saudi Arabia contributed hugely by keeping patients well at home and delivering the medication to their residents, as well as 24/7 online counseling. Alhamdulillah, all of you see about the service from whole hospital, MOH hospitals or National Guard, King Faisal, military hospital, all of them send the medication to the patient at home, even in the outside the cities. Also, pharmacists trained to able to identify incidents and also diminution and avoidance of spreading COVID-19 by social distance. Pharmacists were heavily involved in community service participation. Some of pharmacists work as a volunteer in the vaccination center also. Encouraging the public to wear a mask, social distance, use of hand sanitizer, special in community pharmacy. Online webinar participation to following WHO guideline and keeping up to date. Like our webinar, now lots of webinar, it's virtual and online after COVID-19 pandemic. We'll talk about how the pharmacists dispense medication during the pandemic. Pharmacists play an important role in refilling medication in timely manner, which reduce unnecessary hospital visits. There are some clinics in big hospital utilized as a clinic for the refill and just take medication as a refill, special for chronic patient and stable patient. Many big hospital in Saudi Arabia utilize drive-through for medication, special for refill medication, and mail code by send medication by mail like SIMSA, car delivery, and telemedicine were initiated. For example, clinical pharmacists for anticoagulant clinics, some of clinical pharmacists and some of big hospital utilize this service for the patient during the pandemic. Infected patient and those whom are home quarantined, isolated medication have been delivered to their homes. Even some patient is positive cases, medication will deliver to them to their home. Medication reconciliation and patient counseling, it's very important to process to explain for the patient how to use the medication. Pharmacists performed patient counseling during reconciliation using different platforms. For example, online remote counseling, telephone, mail, and phone application. Either online remote or telepharmacy by application, or they can call them by phone. After reviewing, the physician orders pharmacist must ensure the appropriateness, safety, and cost effectiveness of medication for patients. Especially this is for anticoagulation clinic, and in my hospital is this implemented. This analysis is conducted along with the lab result, clinical status, and taking into consideration the patient home medication. This is the part one. Now I will talk about part two. I bring to you one study from the government of New South Wales. They give very nice recommendation about the safe handling of medication during COVID-19 for the inpatient setting. This guideline were created for the safe handling of medication during COVID pandemic by the government of New South Wales Public Health Facility Policy Directive. It was for inpatient setting. This document is attend. The purpose of this document to be used by relevant stakeholder within a facility include pharmacy department, infection control practitioner, and directors of hospitals. There were 7 recommendations or 7 elements. First one, inpatient use of patient on medication to an approved COVID patient for patient who the approved already positive case. Second, inpatient handling patient on medication to an approved COVID-19. I'm sure all of you know what means on medication, the medication who the patient bring it to hospital by himself. Third element was inpatient storage of patient on medication to an approved COVID-19 or positive patient. Number 4, inpatient storage of hospital issue medication for COVID-19, the whole storage process. Number 5, handling hospital issue medication following discharge of COVID-19, the patient after discharge when he the positive. Number 6, medication unused for resuscitation or intubation, special case for the ICU patient after intubation, used for the treatment of COVID-19. Last one, disposable of contaminated or potential contaminated medication. I will explain all of those one by one. I will start with the inpatient use of patient on medication to approved COVID-19 patient. In normal case, on normal situation, we approved on medication in the special cases with our policy in the hospital. But during COVID-19, the story is different. Patient may bring their own medication into the hospital. This aid to the medication history taking process and avoids missing dose of medication. Patient on medication should not be used for administration during hospital admission unless unavoidable. For example, stock unavailable through the hospital pharmacy. Second recommendation for inpatient handling patient on medication and approved COVID-19, sorry. If the handling of patient on medication is necessary, we are now approved it because the medication is not available. For example, the best practice is that all medication must be handled with the gloves hand, and hand hygiene is performed after glove removal. Any surfaces such as bench tops, which the medication have direct contact, should be wiped down with an approved disinfectant wipe. Number 3, how we can store the patient on medication in inpatient setting. Ideally, patient's medication should be returned to the patient place of residency by a family member, or the patient will take them once discharged from hospital stay. After discharge, we give the patient his or her medication to take it, her medication. To minimize the risk to the individual, retain the medication, place them in a clean and sealed plastic. Before we give it to the patient, we have to clean, then seal the plastic bag, and advise them not to be open the bag for at least 5 days. We might make sure is no more infected after that, to reduce the risk of potential contamination with the virus. If required, refrigerated for medication like insulin or other medication, stored in the ward fridge is identify sealed plastic bag. We have to identify the sealed plastic bag for the patient as a on medication and as COVID patient. Bag contain potentially contaminated medication should be cleared, labeled to make a clear appearance to the anyone who may get into contact with them. To minimize the risk of the number 4 also, storage of medication. 1 second. Inpatient storage of hospital issued medication for COVID-19 patient. To minimize the risk of contamination, hospital issue medication for COVID-19 should be stored in the ward medication room, not inside the patient room. Okay, the medication should be stored in the medication room, not in the patient room. Clinicians should be encouraged to prepare and obtain exact dose. For example, 10 milligrams is equal 5 cc, should be take 5 cc outside the room of patient room and make it in the medication room. From the medication room before entering the patient room. Medication that are single patient use. For example, inhaler like Ventolin or eye drops can be kept in the patient room, because for this patient, only one patient, we have to keep in the patient room. Element number 5, handling hospital issue medication following discharge of COVID-19 patient. How to handle this medication for patient discharge after COVID. Medication that are expensive or low supply. So, you know, as we talk first about shortage of medication. Some medication, it's not available anywhere. Preservation can be considered if the medication is placed in sealed plastic bag. Clearly, add, identify, and then return to pharmacy. After discharge, patient discharge, we take this expensive medication and low supply. We have to put it in the sealed plastic bag and identify, okay, then quarantine for 5 days to make sure it's no more infected from this medication. And also, I told you this, the bag should be clearly labeled with the date of quantity commencement, because make sure when we can open this sealed bag. The for patient ICU or intubated patient, medication sometime unused for resuscitation of intubation kit used for the treatment of COVID-19 patient. It's recommended that unused medication that have been exposed to COVID-19 patient should be destroyed and disposed of. However, as usual, as I told you before, there are some medication, it's very expensive and low supply. We have to deal with it special. In the event of supply is limited, the entire kit can be retained to pharmacy in the same process and the same protocol, sealed plastic bag and quarantined for 5 days, and the bag should be cleared, labeled as contaminated with the coronavirus or positive cases. Last element, it was how we can dispose the contaminated or potential contaminated medication after patient positive case. Medication required disposable should be placed in sealed plastic bag and disposed of as a hazardous, and keep it in special area, identify area for the administration of hospital, how can deal with this medication. This was last slide for my presentation, and this is my reference about my presentation. Thank you for your listening.
Thank you very much, Dr. Saleh, for this informative presentation, and we will start now to answer the questions. So we have a question related to the COVID vaccine. So is a clean room or ISO class 5 air environment required for COVID vaccine preparation?
Clean room or hood with the class 5 is not required for dilution or preparing vaccine dose. This came from the emergency use authorization fact sheet for both Pfizer and Moderna vaccine, allow 6 hours at room temperature once the vials have been punctured, regardless of dilution or preparation environment.
Okay, so we encourage everyone to write a question in the Q&A tab. And I have also another question, Dr. Saleh. So several studies investigated the prevalence of medication safety event in hospitalized patients during COVID, and the majority found it to be very high. Could you please give us some example of such events?
Sure, Doctor, a good question. To optimize use for PPE, supplies and reduce health worker patient exposure, hospital sometimes kept patient infusion pump in the intensive care, especially in ICU, outside patient rooms by use extended tubing. This has increased the risk of medication being given to the incorrect patient or incorrect medication being delivered to, and reduce the ability of the patient to verify the medication given. Also, an ability to measure patient weight during telehealth appointments lead to incorrect dosage of weight-based medications such as chemotherapy.
Okay. So I don't think we have more questions. So at the end, we really encourage all healthcare facilities to capitalize on the lesson learned from their COVID-19 responses. They need to take the best of what worked and build that into a new post-pandemic operational plan or operational model with a goal of delivering a better patient outcome. Finally, on behalf of the SPSC, we would like to thank Dr. Saleh Al-Anizi and the audience for their active participation. SPSC would like also to remind you to apply for the 5th National Patient Safety Award for the following tracks highlighted on the presentation now. The deadline for registration will be, inshallah, by 30th of September. Also, we would like, Dr. Saleh, can you switch the slide, please? So we'd like to remind you also to register in the upcoming World Patient Safety Day webinar series for medication safety. As shown in this schedule, you can register through our SPSC website. We appreciate if you would fill out the evaluation survey sent to your email after the session. And thank you for joining us today. And we look forward to welcoming you back in the future webinar. Thank you very much, Dr. Saleh.
Thank you, Dr. Abir. يعطيكم العافية جميعا. Thank you all.
شكرا.
Thank you.